All right. Let's get started. So, good morning, everyone. My name is Jonathan Flores, and thank you so much for joining me today for a session titled "The Untapped Potential to Strengthen Democracy" with the Vot-ER. Um, I'll be your presenter for today, and the chat should be live. This like my first time working with this system, so hopefully it's working well. But I know we have Lexi from Care Message taking care of it. But please feel free to ask any questions through there, and I'll make sure to get to any of those questions in the chat once I'm done presenting. And then, with that being said, let's get started. So, like I mentioned, my name is Jonathan Flores. I am Vote-ER's Deputy Director of the Community Civic Engagement Program, and I've been here at Vote-ER since 2023. Prior to joining Vote-ER, I also spent a little over 4 years at a federal qualified health center, Ultimate Health Services here in Los Angeles, where I'm based out of. Basically, integrating nonpartisan civic engagement into the daily workflow, which is what I'm going to be chatting about with you all today. Um, it was there at Ultimate where I saw firsthand how essential it is for health centers to leverage their status as trusted messengers within their communities that they serve, right? So, for example, I remember I was assisting a senior patient who was intimidated by LA County's new voting machines that they rolled out a couple years ago. So, after she successfully voted through that voting machine, she told me that, without her doctor's simple reminder to, hey, go vote for your health, she likely wouldn't have participated. Simple as that. And she came to one of the clinics where we were hosting a vote center, and she was able to vote there. And just that simple interaction really was the perfectly crystallized the mission, right? Which is voting is healthcare, right? And it's why I came to Vote-ER, and today I'm excited to partner with all of you to build effective, nonpartisan voter registration and turnout efforts directly into your very own health center spaces or any other healthcare space that you're in. So this is our agenda for today. In this session, I'll walk you through different, just Vote-ER's approach and strategy for engaging essential partners in this work. We'll be covering the link between voting and health, right? The importance of advocating for your patients and communities through nonpartisan civic engagement, how Vote-ER helps, right? Like who Vote-ER is, and a look at our nonpartisan resources that we have for partners. Looking ahead of 2026, just preparing for next year's election cycle and sustaining long-term engagement, as well as taking the next step. Sharing concrete ways that you can partner with Vote-ER today. Uh, Basically, at the end of this presentation, I want you to leave to leave the session knowing 4 points, right? One is that nonpartisanship is essential to Vote-ER's work. Second one is that Vote-ER's tools are fast, easy, and simple. Third one is that there's a relationship between voting and health, and a healthier democracy is one where our patients vote. And the fourth one is that health organizations and professionals have a unique opportunity to utilize their trusted voices to successfully turn out communities to vote. So now, let's start with the link between voting and health. Here at Vote-ER, we understand that voting is just one tool to advocate for what we really care about, right? And through research, we've seen that our communities are healthier when more voters can participate in the democratic process. So we cannot begin to address the social determinants of health until we begin to address and point out just the different interventions towards these structural determinants of health. And this is where voting plays in the upstream of causes where voting is more effective. Um, as mentioned by Daniel Dawes from the Political Determinants of Health, right? Voting is arguably the most important aspect of the political determinants of health. And basically, Vote-ER came out of the realization of a major issue within our democracy and our healthcare system here in the US that 72 million eligible people are not registered to vote here in the US. and that's the about the same amount of the entire population of France. Uh, and why? Because most of them haven't even been asked to be registered, right? You might go to the DMV and they might ask, but most understand that there's a lot of folks who don't have an ID yet, or they're working on the ID and they just skip that voter registration question on the DMV as well. Um, so yeah, so about 62% have mentioned that they've never been asked to vote. And when you look at the top three groups of people who make up the majority of that number of unregistered voters, these are folks who are people of color, low income, who are young, and basically these are the patients that we see almost day to day. Um, so the question here is, what if these patients were asked to register to vote at their clinic within an exam room, right? How would this begin to transform their healthcare experience as a whole? So in 2021, a study from the Journal of General Internal Medicine found that health professionals as well are 12 to 23% less likely to vote than the general population. So what does it mean for our healthcare system when health professionals, the people in the force of our hospitals and clinics who see the real impact of policy on our patients and our institutions don't vote? And this is again a place where Vot-ER steps in and helps lower this percentage. And this is uh, a way how Vote-ER helps. Vote-ER, we are a 501c3 nonprofit organization working to integrate civic engagement into healthcare settings. So far, we partner with over 900 institutions to bring nonpartisan tools and programs to every corner of the healthcare system. And this is why, like I mentioned, and what has been the topic of my slides these past couple of minutes, is that the health space has a unique opportunity to help, and it's because health professionals are the most trusted professionals in the U.S. With about 83% of adults seeing a health professional in 2022. And we here at Vote-ER, we create free and very easy to use nonpartisan tools and programs for civic engagement in different clinical spaces. So, actually, our main tool is our Vote-ER badge, which actually I have right here next to me, but I think with my video you won't be able to see it. Um, we also create custom digital materials for teams and organizations, institutions that they like. So QR codes, virtual posters, all of that. We do create that as well. Um, we also create email and text templates that can help staff and patients who are eligible to vote. And all of our tools are free and super easy to use. Um, and they're also undisruptive, optional, and nonpartisan. So we're always looking at ways to show our commitment to voting rights and health equity. So registering our patients that are eligible with Vote-ER's help is easy. There's a nonpartisan way to do it as well, and it does not interrupt providers as they care for other patients, um, as they use and implement our materials. So, like I mentioned about two slides before, right? Our partners and health professionals are in a very unique position to do this and have conversations around voting with patients. They're meeting folks where they are at in trusted spaces like clinics and health centers, and many times just working with communities that are often the most underrepresented at the ballot box. So, basically, how it works, and here's an example on the slide, is that the health professional, they ask simple questions during social history in intake, as well as during discharge, right? So simple questions like, do you smoke? Do you drink? Are you wearing a seatbelt? Are you registered to vote? One of the also tools that we provide at Vot-ER is our conversation starters. Where basically it's a conversation starters that we put together with using behavior economics, using some experiences from healthcare professionals that have been doing this work within their clinical settings, as well as voting rights experts, uh, where it basically engages in different situations, right? Whether a patient is really excited to vote on every election, or a patient is just apathetic to it, as well as any other situation that a healthcare professional might find themselves in whenever they're asking these questions. And they're both available in English and Spanish as well. And because our partners serve as trusted messengers, and our tools, as I mentioned, are seamlessly integrated, we are in over 900 healthcare sites, including hospitals, medical schools, federal qualified health centers, and when I say all these 900 sites, you're gonna see our Vote-ER posters, handouts, and they're usually tabling as well. Um, our partner health centers as well have sent a total of 2.1 million text messages to their patients, encouraging to vote if they're eligible, right, and to register as well, and sending voting reminders throughout just election season. And we have a little over 50,000 healthcare professionals within our network. This includes doctors, nurses, social workers, promotores, uh, uh, you name it, that use our Vote-ER badges and lanyards. And actually, last year in 2024, Vote-ER had a record year just across the board. Um, we were able to help a little over 64,000 eligible people complete their voter registration or double check that they were registered to vote. Our partners also reached a little over 1.3 million unique people to remind them to vote through healthcare based emails or text messages. Um, we also helped 30,000 30,000 unique patient voting site visits for our patient voting website and program that we have, which we were able to help and provide hands on support to about 1,700 voters who needed uh, those patient voting resources. And just last year, we had a little over 17,000 new health professionals engage with Vote-ER. So it can be by ordering their tools and materials, whether as an individual in the institution or working with their institution to integrate Vote-ER within their day to day tabling, sending these text messages, emails out, and just different other ways that they were able to engage. As I mentioned, I am the deputy director for the Community Civic Engagement Program, which is Vote-ER's small grants program that we have for community health centers, federally qualified health centers, and lookalikes. And basically, our CCP program helps expand nonpartisan civic engagement through voter registration and voter turnout initiatives in health centers. And the grant actually enables health centers to integrate these initiatives into their existing health center operations, into their day to day. And that's something that we're actually looking forward to having it next year as well in 2026. And then that's just one of the other programs that here at Vote-ER we provide. I did mention there was patient voting as well. We have the Healthy Democracy campaign for any of the medical or pre-med students as well to engage in a national competition to do voter registration. We also have our fellowship program where we help individuals build an ongoing campaign, whether within their institution or within their communities. Which we're actually are at the tail end of this year's fellowship program. But then there are also many other ways where we help build nonpartisan civic engagement into healthcare spaces. So one, and this one's actually I'm always really excited about, is just the My Chart and just the EHR integration, right? So we're able to integrate a seamless optional voter registration links and reminders that will be embedded in patient portals, appointment confirmations, or any follow-up messaging. It's really undisruptive, and it's really helpful, as the example that I showed a couple slides ago when you're asking those social history questions as well. We have civic engagement programs for students, like the Healthy Democracy Campaign that I just talked about, which is a national competition for the students to drive voter outreach on campus, which is also ongoing right now, and it's in its final stage. We're also going to be having it next year. We have a patient texting program where basically partner health centers send out timely, nonpartisan text to patients ahead of elections, boosting just different turnout and increasing access to the ballot information. We also provide training and just strategic support. So we create custom support for healthcare teams so that you're able to implement this, just the different civic tools that we have. And then just training to develop site-wide engagement plans. Um, and last but not least, and this is another really exciting initiative that I'm really excited about, is our health centers as polling places or ballot drop box sites. So we know that the health centers act as trusted messengers within their communities, but they're also ADA compliant. So there's no better site than to have it at a health center. Them going to the legal FAQs, and I've said all these, right, maybe fancy stuff and all these different efforts, right? But number one question that we have, and that we do get a lot from healthcare professionals is it legal? And the simple answer is yes. Actually, the National Voter Rights Act of 1993, it's the same law that requires the DMV to register voters, actually encourages nonpartisan voter registration in healthcare settings. So voter registration belongs in the hospital and your clinic, just as much as in the DMV. So Americans often actually do have more regular interaction with their healthcare providers than with the DMV. So bringing nonpartisan voter registration to our hospital will be an important touch point. And also, our partners at Nonprofit Vote have released a set of legal guidelines to help nonprofit organizations understand what they can and cannot do in regards to just voting issues, right? So they did mention that 501c3 organizations may be able to engage in voter registration, voter education, and get out the vote, as long as it is conducted in a nonpartisan manner. I'm just checking the time. Okay, 51. Um, this means that clinicians and healthcare organizations can point patients in the direction of posters and handouts. They're able to say that they're offering a service for patients to register to vote, but do not endorse any political party. And also, they can help a patient complete their registration form, of course, remaining neutral um, while doing this. So take the next step, right? You're probably thinking right now, hey, Jonathan, this sounds so good. Thank you for the legal FAQs. Thank you for letting me know these different programs and resources that Vot-ER provides. So what's next, right? So there's actually some key dates on the horizon. And basically, each of these states represents a peak or civic holiday that's an opportunity to engage in nonpartisan voter engagement. Um, Back in September, we actually had the National Voter Registration Day on September 16th. But actually, in 1 week, we are celebrating Vote Early Day, where we encourage staff, patients, and members to go ahead and vote early if there's an election happening this year in their state or in their community. And some of the elections for 2025, for example, there's one here in California where I'm based out of, as well as, I believe, New Jersey, Virginia, Pennsylvania, just to name a few. They're actually having election day on November 4th, and that's also a great opportunity to do a final push and remind patients and your staff that, hey, it is the last day to vote. If you're eligible, go ahead. If you haven't done so, make your voice heard. For these next slides, it is completely okay to pull out your phone. I will also be dropping the links in the chat as well for you all. But definitely, get a free digital Vote-ER badge, and basically you're turning voting into a health multiplier. So you're free to scan this QR code, and we will send you a Vote-ER badge and a lanyard for you at no cost, completely free. Fill out the CCP interest form. I mentioned a little bit about our community civic engagement program, our small grants program. Right now, um, it's not active for this year. We will be opening the application up next year. But in the meantime, I do encourage you all to please fill out the interest form if that's something that you or your health center might be interested in. And as I mentioned, there are multiple elections actually happening around some of our states. And we're having a Get Out the Vote phone bank event in the next couple of weeks. So please join. There's the QR code. And basically, all we're doing is we're calling fellow healthcare professionals that use our Vote-ER tools, as well as anyone who has been helped to register to vote using our Vote-ER tools or have checked their voter registration. We're calling them. They're located in these states where elections are happening. Just a quick reminder to, hey, go out and vote. These are really, really fun. And then with this, my presentation concludes. So thank you, of course, to Care Message for having me here today. Now I will go ahead and answer any questions you had in the chat, or I think that you're able to unmute and see if there's any other questions that I can help answer. Okay. See, Kate was a question. Here's about the states that may also have changes to the. Oh, let's see. Oh, here's the chat. Okay, great. I was looking at the wrong chat. I got scared. I was like, "Oh my god, did I just speak for like almost half an hour without actually being active?" No, no problem. Thank you so much. And then yeah, feel free if you have any questions, put it in the chat. In the meantime, I will drop the links that I had for the QR codes as well in the chat. So if it's a little easier for you to just click on it, which sometimes it might be, um, then yeah, we can go ahead and click from there. Oh, there we go. And then if there's any more questions about Vote-ER, I know that the care message team was able to load our one pager as well, so you're able to download it, I believe, from here as well. And the last link is our Get Out the Vote link. Get Out the Vote phone bank link. So just dropping it off right here as well. Yeah, the one page is under docs. If you like to download and get a little bit more information about Vot-ER as well as compliance, in case that this is something that you would like to share back within your organization or even your compliance department, and see if it's something that you'd like to do. Okay. All right. Well, with that, let me just check. No final questions. Um, with that, thank you so much. Enjoy the rest of the conference. And thank you so much for being here, and enjoy the rest of your day. Thank you all.